Very warm welcome to all the parents listening to this session. I am Dr. Parag Dekate. I am a clinical director of pediatrics and a senior pediatrician at KIMS Cuddles, Kondapur. What we should monitor after reopening the school so that we can take a decision to keep the school open. What are those? How many kids are attending the school? How many of them getting an infection or been screened properly? What are the public health measures available so that this kids' condition has been taken care of or they get an adequate medical attention? What is the dropouts from the school? How many kids are getting upper respiratory tract infection? How many of them getting sick? And what is the impact of reopening of the school on behavior, psychology, development and nutrition? All those things in together will tell us whether we should keep the school open so that it is a successful activity for the student, for the family and the community. For schools, all the teachers, allied staff should utilize the mask whenever they are coming in contact with the students. About students, WHO recommends not to use mask if the child is less than 5 years of age. But if the kids are motivated, they can comply and utilize the mask as per their need. About the kids more than 11 years of age, they should keep the mask on when they are interacting with someone. They can use cloth mask, triple layer surgical mask or N95 mask. The studies suggest that even a cloth mask is important and effective in prevention of and transmission of COVID-19 infection, so they can adequately use the cloth mask appropriately inside the school. It is advisable to have a good ventilation of the classroom when we are reopening the school. We can keep the windows open so that there is a natural air coming inside the classroom and preventing the transmission of an infection. If we are utilizing the air conditioner, heaters, those should be checked regularly so that they are providing a clean source of air inside the classroom. We have to make it sure they have been filtered and standardized daily so that they are not source of an infection. If you see all the guidelines, there is no guidelines supporting non-reopening of the school. At this moment, there is a sufficient evidence that the school is not an outbreak of an infection and the amount of benefits we are going to get or the kids going to get after reopening of the school, it outweighs the risk of getting a COVID infection. Most of the COVID infection, the kids are asymptomatic or they are mildly symptomatic, and rarest of the kids are getting a complicated or critical problem. So it is recommended by WHO that the places where the transmission of a COVID is less or the sickness is less, it is advisable to reopen the school and we should be promoting our kids to go to the school. At this moment, the studies are going on and we are getting a data, and in the next 15 to 20 days, we assume that we'll have a standardized vaccine for utilization in the pediatric age group. With the current data, we have two vaccines which is looking promising. One is a Pfizer vaccine which is approved by the FDA in United States of America for utilization in the kids age more than 12 years of age with the two standardized doses 3 weeks apart. The second vaccine which has been studied in the pediatric age group for the age more than 2 years of age is Covaxin, which result in 2 vaccine doses 4 weeks apart. And the results are looking promising and we are expecting the vaccine in probably next 20 to 30 days and should be available for utilization in the pediatric age group. Thank you.